Hello, hello, hello. Hello, everyone. Happy Thursday. It is 10 Question Thursday, and this is where we will answer 10 critical care questions. My name is Cheryl. I am a registered nurse. I have over 20 years of experience in critical care, specifically surgical critical care, cardiovascular ICU. I am going to get started. Hello. Bad Gal Scully joined. Hope you're doing well. All right, so the first question. A patient is receiving 0.45, which is half normal saline. For which of the following should a nurse observe? Hyperosmolarity, hyponatremia, osmotic diuresis, and cerebral edema. Well, the answer is cerebral edema. Half normal saline is hypotonic, so it draws fluid in. So administration of a hypotonic crystalloid may result in cerebral edema or seizures. A patient following cardiopulmonary bypass who received multiple transfusions intraoperatively and post-operatively develops tremors, muscle cramps, numbness of the fingers, and hyperactive bowel sounds. For which of the following should the nurse observe? Shortened QT interval, asystole, tachycardia, or bundle branch block? Can you guess? Okay, I'll give you the answer. The answer is B, which is asystole. This patient is demonstrating symptoms of hypocalcemia, which is a low calcium. It is likely related to multiple transfusions received during surgery. Packed red blood cells are conditioned with citrate to prevent clotting. When the citrate combines with calcium, hypocalcemia can occur. Signs and symptoms of hypocalcemia include QT prolongation, shortness of breath, and dysrhythmias ranging from bradycardia to asystole, which is the most dangerous rhythm you can have. Number 3, which of the following should the nurse anticipate following cardiopulmonary bypass? Sodium excretion, potassium retention, increased cortisol levels. Cortisol is a hormone, a stress hormone. Decrease extracellular volume. The answer is cortisol. Increased cortisol levels. So cortisol is a stress hormone. So when you get stressed, the value increases. Okay. All right. Number 4. Which increases the risk of mortality in patients with a stroke following cardiac surgery? A patient with a temperature 37.9, a heart rate of 100 beats per minute, systolic blood pressure of 170, or a blood glucose of 60. No guesses? All right, I'll answer it. Recent data suggests that blood glucose of 140 or less puts the patient at less risk for complications following cardiac surgery. So the answer is a blood glucose of 60. A temperature less than 38 centigrade is needed to decrease metabolic needs. Heart rate is not a risk factor for the development of stroke following cardiac surgery. A blood pressure greater than 200 over 120 or 200 over 100 with acute kidney injury, aortic dissection, ischemia, pulmonary edema, hypertensive encephalopathy is a risk factor for the development of stroke following cardiac surgery. So there you have it. Number 5, which is the risk factor for neurologic complications following cardiac surgery? A, advanced age. B, preoperative premature ventricular contractions. C, stable angina. And D, acute respiratory failure. The answer is A. Advanced age. So advanced age is recognized as a risk factor for the development of neurological complications following cardiac surgery. Other risk factors include post-operative dysrhythmias and unstable angina. Acute respiratory failure is not a reported risk factor. Number 6. For which should the nurse monitor when caring for a patient receiving Haldol or Haloperidol for delirium? A QTC prolongation, first degree AV block, atrial dysrhythmias, or ischemic changes. Haldol, the answer is a QTC prolongation. So your QTC interval will be longer. It can lead to the worst thing, asystole. So it's a complication of Haldol. So typically before it is prescribed, the provider may ask you to get an EKG so they can see what the QTC is. Ongoing monitoring with an electrocardiogram is essential to mitigate patient harm. First degree AV block, atrial dysrhythmias, and ischemic changes are not known side effects of Haldol therapy or haloperidol therapy. Administration of which medication is the patient at risk for neuropsychiatric changes? A. Metoprolol, B. Levofloxacin or Levaquin, midazolam, which is Versed, and Haldol, which is haloperidol. The answer is beta blockers. Which is a beta blocker? Metoprolol. All the meds that end, most of the meds that end in LOL is a clue to tell you that they are beta blockers. Labetalol, for example, is a beta blocker. Esmolol is a beta blocker. Okay, so beta blockers can put the patient at risk for neuropsychiatric changes following cardiac surgery. Antibiotics, benzodiazepines like midazolam, Haldol are not medications that place a patient at risk for this complication. I'm asking a lot of questions about meds today, it seems. The effect of meds. Which patient is at greatest risk for development of post-operative delirium following cardiac surgery? A patient with a hemoglobin of 14.2, age 58 years old, or with preoperative anxiety, or post-operative PaO2 of 55. So the question is, which patient is the greatest risk for development of post-operative delirium? The answer is, surprise, the PaO2 of 55. Hypoxemia is a risk factor for the development of post-operative delirium. Others, including hemoglobin of less than 9.7, advanced age, and major depression, are other risk factors. So a hemoglobin of 14.2 is normal, actually. All right, question number 9. A post-operative cardiac surgery patient manifests lethargy and emotional lability, or they're labile, emotionally labile. Which should a nurse suspect? Transient ischemic attack, or TIA, hypoactive delirium, dementia, post-operative cognitive decline. We know dementia takes months, weeks, years to be dementia. So we know that it's not that answer. Answer is hypoactive delirium. So this patient has symptoms of hypoactive delirium. The symptoms reported are not consistent with the diagnosis of TIA, dementia, or post-operative cognitive decline. So hypoactive delirium, the patient is kind of lethargic, irritable. They're not aggressive like with hyperactive delirium. Hyperactive delirium, the person is, you're not in their reality. They have their own reality and they're trying to do all kinds of things and tell you all kinds of stuff. and probably pulling at lines and such like that. This hypoactive person usually it's not easy to communicate with them a lot of the times. For example, number 10. What is the consequence of unrelieved pain? A, decreased circulating catecholamines. B, increased systemic vascular resistance. C, decreased amounts of interleukins. And D, increased production of anti-inflammatory mediators. The answer is an B, increased systemic vascular resistance. An increase in systemic vascular resistance is due to the physiologic mechanisms associated with pain. It results in an increase in the blood pressure. So your blood pressure will be higher. Levels of circulating catecholamines and interleukins increase as a result of the unrelieved pain. There is an associated decrease in the production of anti-inflammatory mediators associated with increased pain. These questions were taken from my favorite book, of course. No, actually, I got this book, Cardiac Surgery Essentials for Critical Care Nursing. And in it has a bonus. And it's the bonus is for access to online course materials that you can go and you can create your own test, strengthen your, weaknesses in whatever category you're weak in as far as the critical care questions. And it is at Jones and Bartlett Learning. I think the website is jbl.com. And when you purchase this book, I think this book cost me like $50 or so, $54. And you can have access to the test for a year after you log into the website. Or you can go online and you can buy access to it if you so please. But I find this is really helpful for post-op cardiac recovery, pre-op actually too, and more on the rehab side. So this is the end of my 10 question Thursday. I hope your day was amazing. And I will see you. If you need, you can connect with me on my website, CherylPalmer.com. I have my Instagram, of course, CherylPalmerRN. There's links in my bio with other places that we can connect on Facebook. And I do repost my videos on YouTube too. I'm considering doing like YouTube Live. I'm not sure yet, but you learned a lot. I'm glad you learned a lot, bad gal, Scully. Yeah, it is a lot to learn in nursing, and in critical care especially. You have to know a whole lot of detail that, sometimes when you have 4 or 5 patients, you cannot pay attention to that, like on a telemetry floor, for example. So I'm glad I was of some value to you. I will be back next Thursday, 7 p.m. for another 10 question Thursday, and I'll be posting some rhythm posts very shortly and a blog post. So take care of yourself. Don't forget that. And I see you next week. Bye.